My name is Phillip Huffman. I'm a first-year urology resident here at the University of Wisconsin. I am originally from northern New Jersey. I did my undergrad studies at the University of Pennsylvania in Philadelphia, and then I went to medical school at Johns Hopkins University in Baltimore, Maryland. What drew me to urology was that I always knew I wanted to do something surgical, and urology is definitely a hands-on surgical field, but I wanted to infuse something more personal into it, and the pathologies that we deal with in urology are very intimate to our patients' lives, and they make us form really meaningful connections with them. When I matched at UW, I felt extremely excited. I was happy to have gotten through the rather stressful match process. I really connected with the people here on my interview day. I felt that this was a culture that really meshed well with my personal values and how I like to treat people, and felt it would be a good environment for me to do all that learning in. From the very first moment that you get here as a PGY1, you're in the clinics, you're in the OR, and you're working on the floors helping to manage these surgical patients. So I feel that I'm learning how to be a good clinician and making clinical decisions, as well as learning the technical skills that are required in the OR. All of our senior residents are immediately trying to help us learn and are always there to back us up when we have difficult questions that need help answering, and our faculty are really committed to making sure that our PGY1s aren't just people who are handling administrative work that isn't necessarily always the most useful in terms of our growth as physicians. They really want to get us involved both in the OR and in the medical management of our patients to push us to grow and be ready for our senior levels of training. I feel really grateful to be a part of the resident community. We're all very close with each other. It's nice to be able to come to work and feel like you're getting to spend time with friends and sometimes family. Having that community as a source of support has been really invaluable. I wouldn't really want to do residency anywhere else because I'd miss all the people here so much. As a person who's come myself from larger cities on the East Coast, I'd never been to the Midwest before I moved here to Madison. I think it's a great place to live. I've enjoyed the kindness that the Midwest has to offer. I enjoy all of the amenities that are here in the city, and I don't feel like I'm missing out on some of the more metropolitan aspects of some of the bigger cities. I'm a big foodie, so I really like to expose myself to all the new restaurants that I have here in this new city for me. Tried to get on every side of the isthmus to see which has the better food, and I still haven't found a great answer yet, but stay tuned, we'll keep working on that. To someone who's considering their urology training here at UW, I would encourage them to try to be as authentic as you can, because we want to know how you could be a good fit here, and I think anyone really could be.